to better sense, detect, contain and isolate new infections. That's the approach of the new Assurance, Care and Engagement, or ACE group, leading the fight against COVID-19 in the foreign worker dormitories. In an exclusive interview, the ACE group chief tells Cheryl Goh how it will continue with this multi-layered strategy, even as new clusters emerge at previously cleared dormitories.
From over 1,000 COVID-19 dormitory cases a day back in April to fewer than 50 daily cases in the past week, infections in migrant worker dormitories are seemingly under control. And from 1st October, a new team will be in charge of keeping them safe. The Assurance, Care and Engagement, or ACE group at the Manpower Ministry is taking over the work of the Interagency Task Force, which is standing down after 5 months.
Because of the work of the Interagency Task Force, we were able to avert a major health crisis that potentially could have overwhelmed our public healthcare system. So what ACE is created, therefore, is to continue the good work. And we want to build on that.
This involves a multi-layered approach of prevention through safe distancing measures, protection through early detection and rostered routine testing, or RRT, and swift isolation of new positive cases.
The strategy we have designed is allow us to have some confidence of able to detect and manage. Of course, going ahead, and ACE would also want to look at other using better technology to better sense, better detect, better contain and isolate.
He stresses that ACE cannot do this alone, and migrant workers, dorm operators and employers all have a part to play, from practicing safe measures, ensuring safe living conditions, to taking part in RRT.
A roster routine testing is for us to pick up the positive cases early so that we can intervene and isolate those affected workers so that they do not spread out to the rest of the dormitory.
Even though the onus is on the employers to get this done for all their workers to ensure that they're safe, how exactly is ACE going to help to ensure this compliance?
We are also helping the employers by auto-generating the schedule after the first. Once they are registered, the subsequent registration is automatically generated. We are also allowing choices for employers if they decide that it's more convenient for the workers to be tested in the dormitories. We have also set up in-dorm RRT centers. And we are also now going to pilot night testing in the dormitories.
We are still seeing new clusters emerge in cleared dorms. Why do you think this is happening, and what is ACE going to do to deal with this?
So when we say we have cleared the dorms, what we meant is that we have tested all the workers and assured that they have been tested negative before we put them in the dorm. The infection can come from either past old infections, or could be the infection got from a third party, either people coming into contact with the workers and the dorm or in the work site. So I don't think we can always be sure that even we have cleared dorms, that there will be no reinfection.
Mr. Tung, I mean, it seems like a really challenging and daunting task. What made you want to take on this role?
Well, I think when the COVID-19 happened, when we were all during circuit breaker, it really disrupted the way we live, the way we work. And I was wondering what I can do to be part of this effort to combat COVID-19. Then I got a phone call, and I just said yes, and I'm here now.